Have you ever pondered over the question, what are hospice benefit periods? Well, let's dive into that. Hospice benefit periods are integral to hospice care, commencing when a patient elects this service and a physician certifies the patient as terminally ill. In this context, terminally ill is defined by Medicare as an approximate life expectancy of 6 months or less, should the illness follow its normal course. The structure of these periods is quite straightforward, with 2 initial 90-day periods followed by an unlimited number of 60-day periods. There is, however, a condition. The patient must continue to be terminal, and a physician must certify this status at the beginning of each period. So, in a nutshell, these benefit periods are designed to provide ongoing necessary care to terminally ill patients, ensuring they receive the support they need during their final months. These benefit periods are designed to allow for checkpoints to ensure the ongoing patient eligibility for hospice care. Now that we understand what hospice benefit periods are, how does the certification process work? The certification process begins with the election of hospice by the patient and a certification from the physician that the patient is terminally ill. For the first 90-day benefit period, both the hospice medical director and the patient's attending physician must certify the patient. During subsequent periods, only the hospice medical director is required to certify. The certification should include a narrative from the physician, supporting a life expectancy of 6 months or less, as well as the physician's attestation. This certification must be completed within 15 days, prior to or by the 3rd day after the start of the hospice benefit period. If written certification cannot be obtained timely, verbal certification is necessary. From the 3rd benefit period onwards, a face-to-face visit with the patient by a physician or nurse practitioner is mandatory to assess the patient's condition. Therefore, the certification process is vital to ensure patients receive the care they need during their hospice benefit periods. While the process seems straightforward, there are special situations that can impact a patient's hospice benefit periods. For instance, a patient or their family may choose to cease hospice services at any time, forfeiting the remaining days in the benefit period. If a patient decides to re-elect the hospice benefit, a new benefit period begins. Navigating between hospice providers can also affect the benefit periods. If a patient is discharged instead of being transferred when moving between providers, the new hospice provider may need to admit the patient in a new benefit period. Moreover, hospital admissions can play a role. If a patient requires hospital care but doesn't qualify for hospice services during their hospital stay, the patient will need to be discharged from hospice. Upon return to hospice, the patient will need to be readmitted in the next benefit period. By fully understanding these situations, healthcare professionals can better navigate the complexities of hospice care and ensure their patients receive the necessary care during their final months.